Good evening, everyone, and thank you for coming. My name is Matthew Payne, and this is my presentation on how the mental health crisis has not only affected the majority of the world, but it also has affected us here in the city. And I believe that there are steps that we can take to help stop the spread. The main issue that I want to bring up is that this is impacting our public safety system by having a surge of mental health related emergencies. This is not just a healthcare issue, but it also affects our city operations and our resources that are coming into the city. So let's talk a little bit about the city. Hampton is located on the southern end of the state and borders bodies of water such as the Chesapeake Bay and the James River. The city spans across 140 square miles, with the majority of it being water. The city has a large military presence and an abundance of federal employees that work at Langley Air Force Base and the National Langley Research Center. There's also the decommissioned Army Base, which is Fort Monroe and is currently maintained by the National Park Service. The city prides itself on being a dense and diverse coastal city, but what I want to bring attention to is with the large military presence brings an abundance of calls that are tied to PTSD, substance abuse, and depression. Our city is the home to multiple civilian and military healthcare facilities that specialize in both medical and psychiatric care. There are 2 college establishments within the city limits, which multiplies the youth population, as well as 2 different venues which frequently draw in large crowds. When it comes to these hospitals, we're already dealing with extended wait times in a bogged down system, and they are already strained past their capacity. When we look into the collegiate establishments, we are also seeing with the youth a higher exposure to PTSD, anxiety, and substance abuse. In between these collegiate establishments and our military facilities, this is where our need is. The population has access to resources, but they either do not know how to utilize these resources, and these hospital systems cannot keep up with the surge of psychiatric calls. The city of Hampton is home to around 137,000 people, which puts it at about 2,600 people per square mile. And as stated before, that the city is pretty racially and ethnically diverse, with 51.7% of the population being Black or African American, a little over 40% being white, 6.3% being Hispanic or Latino, and 2.2% being Asian or other racial groups. And it's important to note that statistically, minority groups such as Black or Hispanic individuals face higher barriers to mental health care and higher crisis rates. The city's median age is a little over 37 years old, with 18% being 65 years or older. It's also important to note that 15% of the population is classified as veterans, which is just over the state and national average. When we evaluate our housing makeup, the average rent in the city is just over $1,500 a month. We notice a rate of ownership being just over 56%. Total housing units, we have just over 62,000. When we look at these numbers, they all fall short of the state average. And the chart to the right breaks down the housing values within the city. And this is just a chart showing the difference of the breakdown between occupied housing and vacant housing, as well as the differences between the standard married couple and the male householder versus the female householder with no spouses present. And as we can see in the chart on the bottom left corner, the amount of female householders with no spouses present almost doubles the amount of male householder without a spouse present. So I know that we've touched on a few little aspects here and there, but let's talk about the reason that we're all here. Throughout the country, communities have been experiencing the effects of the mental health crisis, and Hampton is no exception. We have an abundance of our population that experiences PTSD, depression, anxiety, and suicidal ideations. And the surge can be attributed to a number of factors. We will say that it causes a demand for service, there's limited access to care, and there is an increase in crisis level events that require 911 intervention. Without a formulated plan, the city will continue to see an increased demand for first responders and frontline healthcare workers. And the bottom line is, we're seeing more people reach crisis because they can't access care early. So with this surge of mental health related 911 calls and an increase in demand for resources, a community risk reduction plan should be put into place to reduce the strain on the current healthcare system while simultaneously providing better care plan for those who are in need. And with this plan, our goals are going to prioritize early identification, targeted interventions, and improved access to mental health related services. And if this is done properly, we will hope to see fewer 911 calls, better patient outcomes, and improved quality of life for the citizens of Hampton. And the goal is simple. We're going to have fewer crises, we're going to have better outcomes, and we're going to have a smarter use of the resources that we have at hand. So why is this a risk for the city of Hampton? Well, this is a critical issue because it affects our community as a whole. It's not just specific to one demographic. It affects those of every socioeconomic background, to include those who are responding to the calls. Those who are providing the care also face the possibility of experiencing a mental health crisis themselves. And because of the shortage of qualified mental health physicians, it creates a pitfall in those who are seeking psychiatric care. And this delay leads to more severe mental health occurrences like suicide. And sadly, as we see more delays, the burden then shifts to 911 resources. So we have noticed that a drastic increase in the need of mental health services can be tied directly to the COVID-19 pandemic. The trends that were associated with the pandemic, such as social distancing, reliance on government assistance, and the dramatic change in how we lived our lives every day, are directly tied to the surge of calls. The increase in the cost of living can directly be correlated to the increased stresses that we deal with on a regular basis. This is brought upon by the increases in the cost of groceries, housing, insurance, and healthcare prices. We can also note that those who are living in poverty are less likely to have the knowledge of the resources or to receive consistent care. And in our research, we have noticed that people just aren't getting help early, which is directly correlated to the increase in mental health related calls. Finally, even though that we've come a long way when it comes to acceptance for the need of mental health care, there's still a stigma tied to it. We see it in military, people that work as first responders, for fear of judgment, and it's no secret that with our heavy military population, we bring increasing conditions such as PTSD, depression, substance abuse, and trauma-related disorders. And unfortunately, this class of patients requires a specialized care from a system that's already oversaturated. And in the diagram to the right, you can see a breakdown of the veteran population and how it compares to the surrounding areas of the state. So now that we've talked about the purpose and the problem that is associated with this community risk reduction plan, let's talk about how it will be implemented as a solution. With this plan, we will aim to shift our efforts from a reactive style of patient care to one that is more proactive. And we're going to do this with a 3-step plan, with our focus is going to be on education and early intervention, a co-responder model, and building a community paramedicine program that's functional for our community. When we talk about education and early intervention, we want to put a focus on educating the public on access to these resources, as well as tips that they can do to prevent themselves from entering a mode of crisis. With our co-responder model, effectively called the CARES unit, we are going to pair EMS professionals with members of the Community Services Board to evaluate whether patients meet the criteria for an emergency custody order or an ECO. And with our mobile integrated health or community paramedicine program, we will commence doing follow-ups after patient discharge, as well as case management for repeat callers. So how would this plan affect the community? If it is implemented appropriately, it should effectively reduce call volume, it should decrease on-scene times, and should decrease the amount of times that repeat callers are utilizing the 911 services. And in doing this, we will improve the ER capacity, we will increase responder safety, and build an efficient system that is beneficial to both the responders and the patient population. When it comes to funding this program, we look at our first-year investment to be around $800,000 to $1 million, with a recurring cost of $400,000 to $800,000. We hope to use funding sources such as federal grants, local partnerships, and we hope to collaborate with the multiple different hospital systems that are in the area to come up with a system that works. So in conclusion, we want to reiterate that Hampton is a moderately dense and economically diverse community with a significant public safety need. The key factors that influence our current fire and EMS department is population size, our diverse racial and sociological makeup, our higher than average poverty rate, our aging population, and our high-risk environments. This plan takes a proactive approach by expanding on those prevention strategies that we discussed earlier, and we're also going to utilize new tactics like community paramedicine and changing to our risk-based deployment program for our resources. Thank you for joining us in this presentation, and thank you for your time.